Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in optometry. Discover a new show at itube.net/podcasts.
You're listening to The Mod Pod, a companion podcast to Modern Optometry, the go-to publication for full-scope ODs navigating the evolution of our profession. I'm your host, Cecelia Koetting. Join me every month to hear me speak with authors from each issue. We'll talk about their articles, get more in depth about particular points of interest, discuss how to apply tips and suggestions in real-life practice, and more. Hi everyone, it's Cecelia Koetting coming to you again from Denver, Colorado, and welcome to this episode of the Mod Pod. Today we have our two guests. We have two today. This is amazing. I'm really excited about this. We have Jessilin Quint, who is owner at Compton Eye Associates in New York, New York. And then we have Mahnia Madan out of Vancouver, and she's owner of the Vancouver Eye Doctor in Vancouver, British Columbia. Welcome, both of you.
Hello, hello, hello.
Yeah, thank you.
So your article in this month's in May, Modern Optometry, is Real Talk About Eyelash Enhancements. And you guys took opposing viewpoints to discuss the different aspects. And it was a really interesting, I liked reading. It was really great. So it's great to have you both here on the Mod Pod. But before we jump into your article, I'd love if you could tell our audience a little bit about yourselves and your practices. And the question of the day today is, when you eat pizza, do you fold it? Jason, we're going to let you take it away.
All right. So as you referenced, I'm from New York. I've been a private practice owner for about 10 years now. Very involved in organized optometry with the AOA, with my local alumni, as a local alumni with SUNY, doing a lot of work with them. Just happy to be here. And if we're talking about pizza, I mean, from New York, the only way you have to do is fold it, right? Absolutely.
There you go. Mahnia, what about you?
Yeah, thank you so much for having me on here as well. And definitely not, I don't fold my pizza. I like a buttery crust, and I love dipping my pizza in sauces like the sriracha mayo. So that's my favorite way of enjoying the pizza. I'm from Vancouver, totally on the opposite coast from Jason here. And it's beautiful and sunny in Vancouver all the time. Just kidding. We call it Raincouver because it does rain here a lot. But I'm in a private practice in ophthalmology and in optometry. And I actually just finished my term as president for BC Doctors of Optometry, which is our local provincial organization. So super grateful to have had the opportunity to serve as president. And now I'm enjoying the past president role. It's kind of fun.
I'll take a moment there for a big round of applause.
Yeah, absolutely. Congratulations on that.
That is an amazing and tough job. So
absolutely, thank you.
For me, if it's Costco pizza, I'm folding it because it's giant. But I mean, otherwise, no. So I'm an Andy.
I gotta bring you guys to Brooklyn.
Yes. Okay, so let's jump into the article. And man, that was a great article. It's a really touchy, tough subject, especially when it comes to my patients. For me, as an ocular surface disease specialist, eyelash enhancements are really a little bit of the bane of my existence. I know I'm not going to get them out of them, and it's why I really appreciate that both of you as authors presented very thoughtful arguments for both sides. And that was the cool part about this, was it was the for and against. When you talk about lash extensions, it is interesting to think about the benefits in patients' confidence. And this could be tied to potential benefits in their mood, anxiety, depression, things we don't really think about. Can you give me a little bit more thoughts on other benefits, or kind of expand on that?
I mean, I could start there. It's just funny as I talk about it. Obviously, I've never used them, but I feel like I'm like a self-proclaimed expert in this area because like 95% of my patient population, actually no, 99% of my patient population of the females wear these, and I've learned very long time ago that that's not a hill I'm going to die on. So I have to learn how to work in this arena, And so like, listen, they love it because of the volume and the length that it gives, and it's quick. And once they get hooked, they're very addicted to it. So we've learned to kind of figure out how to live in that arena.
I mean, absolutely. I mean, who doesn't want to look beautiful, right? And it's not only we see this in eyelash extension arena, but we also see this in our contact lens studies, right? The number one motivator for patients to wear contact lenses is because they feel more confident in their contact lenses versus glasses. And so, like Jason said, we can't fight with it, but I think we can advocate for safe, wearing of it.
Yeah, I love that. Yes, I agree. Not a hill I'm going to die on, and we have to we just have to work with it, right? And so that being said, the other end of it being the cons in regards to some things you guys mentioned were blepharitis, meibomian gland dysfunction, and the glue itself, and we know it can be severe. So what are your thoughts as far as good ocular hygienes and maybe some suggestions for the patients and for our listeners, right?
Yeah, I mean, I'm really curious to see what kind of things Jason is seeing in his practice. I mean, I do definitely have patients wearing eyelash extensions, but probably not to the volume that Jason has. But I was actually really surprised to see patients actually developing severe dermatitis from eyelash extensions, right? And I always thought that was maybe something rare that wouldn't happen, but I'm quite surprised to see how often that happens. So that's a really serious concern, that I do want to warn the patients about and talk to them about. That this eyelash glue, that they should perhaps test it on themselves beforehand before they apply it to their eyelashes, because some of these, severe contact dermatitis can take a long time to heal and can have such a severe impact on patients' quality of life as well.
In my exam lanes, I have anterior segment cameras, and it really created some amazing teachable moments, just really to show them what's going on. And quite often they get freaked out. Just kind of to answer Dr. Madan's question, we see it quite frequently, but I see it as an opportunity to um, educate them on things that they can do, and really technicians that they should seek out. Like, I teach them about, the distance that I want, that I think the extension should be from the skin to remove direct contact. I talk to them about, I love hydrochloric acid. Like, I love it for the patients. I encourage, a lot of my patients are actually lab techs. So I talk to them about how they can use it safely. As she just alluded to, the patch test, or like a contact test, very important when we talk about the adhesives, and seeing if a patient is going to have the potential of an allergic reaction prior to doing something or working with someone new. So all these different things, again, it just allows me to educate my patients on a level that probably wouldn't have been able to happen otherwise.
Yeah, and I think it's nice that you guys talk to them this way as well, and I do too, because as opposed to them shutting down and stopping listening to anything I say, because I'm like, you cannot do these.
Yeah.
They're engaged. They're engaged. They're like, well, then I'm gonna go see a different doctor, right? What specific? You mentioned hypochlorous spray, right? So, what other specific cleaning products have you guys found? Because a concern too that I've had, in some of the ones that I've come up with that work, thinking about the glue, right? We don't want to break down the glue, so it just negates the whole point. So anything that you suggest that doctors could suggest to their patients?
Yeah, I mean, I definitely think extensions do require daily cleaning, right? And we definitely want to talk to our patients about it and really send that message home with them. I don't usually recommend specific products, but I'm curious to see what you guys will say. But I do tell them to stay away from more of the oil-based cleaners, right? Because they will degrade the glue much quicker, and make the eyelashes not stay on longer. So it definitely warned them against that. But other than that, they really do need to do good cleaning. I really do like hypochlorous as well, because we know that it can kill the bugs that live on our eyelids in a safe way, in a easy concentration.
Yeah, I'm almost exclusively hydrochlorous at this point. We actually sell it out of the office for the reasoning that she said, the antimicrobial effects, but it also, the fact that it doesn't leave any residue, the fact that it doesn't have it's really not an irritant. You can spray it right on there. You don't have to worry about the digital kind of rubbing action. I just, yeah, we're pretty much exclusively that.
Okay. So yeah, I use a lot of that and I had in the past. One that I picked up more on and started using a little bit more is actually ZocuFoam. Because it's super gentle, and especially because I'm finding a lot of these patients actually have Demodex blepharitis. And so for me, I want something, and I'm not a huge TTO fan, so I go the okra extract route. And I found that it doesn't typically break down the glue for those patients as well. So that's one I found that's pretty helpful. Uh, yeah. So, Jason, you actually mentioned that some of your patients are estheticians or techs that may be actually doing these. Do either of you reach out to? Obviously, you're talking to your patients and saying, "Hey, yeah, take this to work." But do you ever reach out to your local estheticians or anybody?
Yeah, absolutely. We do have some really great contacts with some of the aesthetic clinics in the area. Actually, funny that you mentioned Zocufoam. I totally didn't think to mention it, but we do Zest in the clinic for a lot of our patients that have eyelash extensions, and I think it really works well. We teach them how to take care of them while they're in our office, right, while they have them on, and then of course they can come in for a cleaning before they're going to get their next set on. We take nice pictures so that we can show them, what we're seeing as well. And that's really helpful in driving some of that message home on how to do proper lid hygiene and why to do it.
I like how you referenced local estheticians and lash technicians. I don't know if it's just in my area, but everybody and their mother is a lash technician nowadays in my area. They all have their own Instagram page and they're doing it like out of their basement or the back seat of their car. So it's like it's much a bigger audience for me because I come across them all the time. So yeah.
Yeah, and it's either way, however we can do it, it's a great teaching moment.
Exactly,
Yeah.
exactly.
So the other thing you guys were talking about was actually lash serums, and we can find these left and right now where they're all over the place, whether it be a true serum, right, or something that is a enhancer or growth promoter. And you guys mentioned in the article that there are a number of ingredients that can be concerning, including prostaglandin analogs. Do you have a good resource for patients and doctors to look up these ingredients that may help them understand if they're okay? Or even a few that you would say definitely look out for these.
I mean, I've used, so obviously we know that there's only, well, there is, I'm pretty sure there's only one that was FDA approved, that's the Metapros. And I've used that with success in the practice. I have, and I admit, I have had done some kind of my own anecdotal kind of clinical trials of some of the other products. And I've used maybe one or two over the years that I've seen that I've would stand behind, but nothing that I would really promote, nothing like that was done really clinically. I definitely, if I'm going to recommend something to a patient, if I'm just it's going to be on label, and I would do it that way.
Yeah, me too. I think it's really important to kind of stick with those FDA guidelines, right? The only FDA eyelash growth serum that's approved on the market is Latisse or Bimatoprost 0.03%. And I usually actually caution patients to use caution against them using other prostaglandin analogs because they're not FDA approved. We just don't know the safety of those things. And so there's really no point advocating for any of those things, in my opinion. And then, of course, there's so many over-the-counter ones as well, right? In terms of in the cosmetic arena where you can find these prostaglandin analogs. And I think it's really important for patients to understand that cosmetic companies are not required to list potential side effects on their packaging. So we have no idea really what those patients have no idea what it's going to cause. And there are so many lawsuits, if you kind of even just do a Google search, you can find that there have been a lot of these over the counter products have been sued because patients have experienced side effects that they weren't aware of that would come out of these eyelash growth serums.
So what about prostaglandin analogs aside? Because there are lots of them that actually don't, that are developed by eye care professionals. Um, there's a few of them that are out there. Do you have any of those that you feel are okay? If they're at least avoiding that and more of the enhancement of just health of the eyelashes?
I'm familiar with those. I mean, I don't know, Manya, if you have. I haven't tried any specifically in my clinic. Have you?
No, I haven't either, but I'm mindful of just kind of looking at some of the research, right? There are, of course, non-prostaglandin serums which seem safer because they don't have the side effects of a PGA, but we really don't know if they even work. So they're safer, but do they actually deliver the results? We don't know. because the data is very anecdotal. So there really isn't anything concrete that we can stand behind. In fact, some of, a lot of the evidence is kind of given that grade D recommendation, right, in the medical literature. So for me, I find that hard to kind of really recommend something if I haven't seen the data behind it.
And it's interesting in my practice, the serums are very, very low interest because a lot of my patient population, they want that instant gratification. And these products you have to use for multiple weeks to see evidence of improvement. Um, and my patients are not that
I don't
patient.
have the time for that. Nope.
Never got time for that. I want to put
Not
them
with,
on
not
and
with the
be done.
extension. Nope. And going back to the extension, so a couple things that you actually weren't touched base on, because there's only so much time in an article, but I can ask the questions. Was what about lash perming and tinting, false eyelashes, or magnetic lashes? Do you guys have any quick thoughts on those alternatives?
So I'm seeing a lot of lash perming. Tinting, no, I haven't really seen it. I'm seeing a lot of lash perming, and this is like definitely that risk of allergies, and I would say even more of a risk of damage to your natural lashes. And this is something that you have to keep doing. There's several treatments are required to maintain it. So I see a lot of problems with that, but it is something that I'm definitely seeing an uptick in my community.
Me as well. What about you, Manya?
I agree. I think it's more of the allergic reactions to some of these things, right? People can get an allergic reaction when they dye their hair on their head.
And that's essentially what it is. It's the same chemicals that you use on the head for perming and tinting. That's my big concern.
Exactly. And now you're putting that so close to something that is so sensitive, right? Like your eye. So, of course, the downsides are much, much larger than having an allergic reaction on your head.
Have either of you seen the magnetic lashes?
I was gonna ask you, but I have not seen.
No.
You have seen them,
So I
Manya?
have. It is this liner that you put on that has
I
some
can't even imagine.
in there. No, I've seen them where their lid has been half taken off with it. So I'm not a fan. I am not a fan of that one.
Jason, you've been missing out, man. You got to try
I
these
know.
extensions.
Yeah, I didn't.
Oh
But
yeah.
let me tell you, the false lashes are like. I mean, I'm a huge fan of when the women have the lashes, but these things look ridiculous. Some of them look ridiculous. Are you talking about like the quick, like just you kind of like glue them on and
Yeah,
you rip them off at the end of the night? Like that, if anything, has got to be the most traumatic to the lid margin.
I
But
agree. I would rather those individual lash, it's glued to the lash itself if I have to do anything. So
yeah.
So finally, I'd love to ask the two of you, and Mania, we'll start with you. What is your soapbox? What is your message or wisdom that you would like to impart on our colleagues?
Absolutely. I love this question. I mean, I think what really comes to mind for me is embracing innovation and embracing empathy. And the reason I say that as optometrists, I think if we can be open minded and curious and adaptable to new technology and new ideas in optometry, I think it's going to be great for the profession and for ourselves, right? And then the other key thing here is embracing empathy, understanding our patients better, kind of can really. Sorry, I'm going to re-say that again. So, embracing empathy, right, is empathy can really foster trust and strengthen that patient and doctor relationship, which I think is really important. Not only is the patient going to benefit, you're going to have better outcomes, but as an optometrist, I think we're going to drive more satisfaction out of our careers as well.
Well said. And Dr. Compton, what is your soapbox?
I would love just to kind of piggyback of what Dr. Madan just said with regards to that patient-doctor relationship. I mean, it's just so important. We're talking about this particular aspect of eye care, anterior service, these eyelashes, and there's really a great opportunity to educate our patients because yes, we are doctors, we're healthcare providers, but if we see ourselves as educators, we can really take our practices, our patients really to the next level and helping them understand and appreciate, what it is that we're trying to guide them through and to help them in their day-to-day activities, whether it's eyelashes, contact lenses, or whatever.
That's what we're there for. So, last bit, Dr. Compton, for those who want to know more and hear more from you, where can they find you on your social media?
I would say Instagram's the best at Compton Eye.
Perfect. And Dr. Madan?
My Instagram handle is dr.mahnia.madan. And I'd love to connect with you all. And if you have any questions, please do reach out. And I'm going to put in a plug for Young ODs as well. Just being past president, I think it's just so important to be part of your national, and your provincial and state organizations. We can practice in our silos, right? But I think if we work together, I mean, the career is just so much more fulfilling. So I encourage everybody to do that.
Well, Dr. Madan and Dr. Compton, thank you so much for joining me on the Mod Pod.
Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in optometry. Discover a new show at itube.net/podcasts.
Hi, everyone. Welcome back to the Mod Pod. This is Cecelia Koetting coming to you from Denver, Colorado. And today I am joined today by my friend Jessilin Quint, who is an optometrist in Augusta, Maine, and is a co-owner of Smart Eye Care. We're going to be talking about her article today in the May issue of Modern Optometry titled Do's and Don'ts of IPL Therapy, a brief guide to safe and effective treatment for patients with OSD. Welcome, Jessilin. How are you doing?
Good. Thank you so much for having me. It's so exciting to be here. Hello to all the listeners.
Yes, it's great to have you. And always a pleasure to have a fellow intrepid member and ocular surface disease enthusiast. For our audience, would you mind giving us a little background about who you are and a little bit about your practice, as well as on your lobster roll, do you like it warm, cold, with butter, or mayo?
Ooh, I like it. I like that question. I feel like that question, being a Texas native, is a little bit like, does chili come with beans or no beans? There's definitely like a main way to have a lobster roll. But as I said, I'm a Texas native. I ended up going to optometry school at Indiana University, did my residency in Chicago, and then landed on the East Coast in Maine. Never in a million years would have thought that I'm here, but I love it. And bought with two great optometrists at practice called Smart Eye Care. We have 3 locations and are primarily focused on primary care. And that's kind of where treating dry eye with my patients started. So I became really passionate about dry eye because I myself have dry eye, and for just almost selfish reasons, wanted to kind of know everything about it and what tools and treatments I had. And then I wanted to make sure that I'd never missed that with patients and that I was always offering them tools because I know how impactful having a dry eye condition can be. And so that's where it started, and building kind of my dry eye patient population really just started in my primary care practice. And then from there, that patient group grew, and then we opened up a dry eye center, which has been really fun. And so now I get to live one of my dreams of helping patients treat their ocular surface disease. But as far as a lobster roll, I feel like I'm a little bit of a hybrid. I like it cold lobster meat, but with warm butter. So like the main way is like, cold meat, mayo, and like the Connecticut way is like warm meat, warm butter. So I'm a little bit of a hybrid there, but it's good.
I'm just happy if I get one. And yeah, I like mine warm, but I want it with butter and mayo. I just put it all on there. Just put it all on there. Big greasy mess. So this is a great article on IPL and how to do it in a very thoughtful way to help benefit our patients without promising the world, right? We know it's going to help, but it's not going to fix everything. And very rarely, because it's a multifactorial issue, is anything going to be the slam dunk, right? When you decide IPL, when do you decide IPL is appropriate for your patients?
Great question. For patients that have ocular rosacea or any obvious signs of like Demodex, kind of this blepharitis issue, 100% IPL is always in kind of that treatment protocol. Sometimes it can be tricky if they don't have like an obvious one of those things that I just said. And then it's kind of a question of, what do you lead with? So in patients where they don't have an obvious ocular rosacea or Demodex or blepharitis or like a history of recurrent hordeolums or schlesians. Sometimes I'll start with other things and we kind of see how our therapy responds. And then if I'm not getting adequate treatment, then I'll go to IPL. Because it can be a lot when you're biting everything, off, like and some of these dry treatments and even pharmacological agents can be really expensive. And so you have to kind of pick like what's going to give the patient the most bang for their buck, essentially. So it kind of depends. But for, as I mentioned, kind of those rosacea patients, 100%, I always lead with IPL.
Yeah, I do as well. So in those patients, so talk about even just a rosacea patient, right? What indicates to you that it's time to have that conversation about the treatment?
Yeah, I always start with it when I approach a rosacea treatment or patient and we're talking about kind of a different treatment plan, because as you had kind of alluded to, it's never just IPL, right? It's IPL plus usually some adjunct therapy. And so I always just straight out of the gate kick off like, this is what I'm recommending, kind of a full round of IPL plus maybe Xdemvy, maybe, whatever else with it. And then we kind of get into kind of the nitty gritty of like, is this something the patient can do right now? Can they afford it? Do we start it? Do we not start it? But usually just straight out of the gate, I lead with that. And then we kind of tailor it if we need to wait for timing reasons or financial reasons or any of that. Because I do believe that IPL is super helpful in those. And so if I was a patient, I would want to know like what's going to help me right now. And I really believe that IPL can be helpful straight away.
Yeah, I do too. I absolutely agree, especially with those rosacea patients. And I think another thing is we have to be unafraid and unapologetic to say you have rosacea. There's so much hemming and hawing by I feel like dermatology, like maybe, but it's like no, you do. I can see it when I walk in the room. Yes. So darker skin types. You talk a little bit about this, and oftentimes it's a big no for a lot of doctors, and understandably so. I've had conversations with some of our colleagues, especially Janelle Davidson and Laura Perriman, about how to appropriately treat these patients and still have good outcomes. When you have a skin type 4 or 5, what have you found to be helpful settings that kind of to use on these patients?
I love that you brought up Janelle and Laura because they are,
Yes.
I always learn so much from them. They are rock stars, especially when it comes to thinking about kind of some, skin types 4, 5 plus. Usually I sometimes will just do a little bit of a patch test I think it's really important that we should be doing this with every patient, but really talk about the risks with it. And if you're going into it, making sure that they really understand and you have consent, and don't skimp on kind of even like getting that written consent to just make sure that even if you do a patch test and things don't maybe go quite as planned, that, you've at least had that conversation about the risks at hand. But doing a patch is a very kind of conservative way to see, how the skin's going to respond. And obviously for darker skin types with IPL, you're using low settings, like kind of a level 10. And so sometimes right now, a lot of IPL devices on the market only go down to kind of like a level 10 and they don't go lower in that. So it'll be interesting to see maybe in the kind of next generations of IPLs to come, if they have expanded kind of parameters for the amount of fluence or joules that you can use to kind of best accommodate some of these darker skin types.
Yeah, and I think it depends too on what you're using, what unit you have. And I know that we love our OptiLights and they're phenomenal because they've got a lot of these really great already built-in settings that are kind of easy buttons. I know for mine, mine was picked by Oculoplastics, so we have one it's different, but it does go down to I can go down to 2 millijoules or 2 joules, and so that right, so it does make it a little bit easier, but that's a great point of. It may not be accessible with all units, and that's okay. But a patch test is so important just to see where you're at.
Exactly. Yeah.
So let's take a second to talk about sun protection. We know that it's important to wear between IPL treatments and on a daily basis to protect our face, the back of the hands, because of high risk of skin cancer. What are your pearls about picking a good sunscreen? And do you have any go-to brands?
I think in the space of ocular surface disease, you're already talking about why ingredients matter. And so a natural kind of segue into that is talking about sunscreens and, what makes a good sunscreen and what are ones that could possibly be a little bit of a trigger for rosacea or for the ocular surface. And so I just think it's a natural segue. And especially when you're doing treatments, yes, you definitely need to be wearing sunscreen in between. But really, our patients, like even if they're in primary eye care, right? Like we should be probably having these conversations and being proactive and talking about that. In, stepping aside a little bit from like brands of sunscreen, I always think it's really important to focus kind of more on a mineral based sunscreen rather than a chemical based sunscreen. We want it to be broad spectrum, meaning we're covering UVA and UVB protection. And then I guess brands that I specifically recommend to patients, Ulta MD, but also Color Science. Reapplication is important. We should be reapplying this. And one of my favorite products from Color Science is that they have a mineral-based broad spectrum brush that has sunscreen. So it almost is like a powder, like a face powder that it comes in like different colors and matte. And so if you need a touch up throughout the day and you are wearing makeup, this you can just kind of brush on over it. And so getting comfortable with brands, and everybody's going to have pros and cons, and, you just got to figure out what you recommend. But it's also a great way to kind of increase revenue in your practice because you can sell these. A lot of these brands kind of align with optometrists. And so it's just kind of a product that you can sell. What about you? Do you have a favorite sunscreen brand?
Yeah, so Ulta MD is definitely one of them, and I mean a lot of it's from my dermatologist and aesthetics clinics I've been to, right? That's a lot of where I've picked it up, and then also Laura Pyramid turned me on to Kinesis is another one that I like. Yeah,
Those are great. Those are
yeah.
definitely great.
So on the note of skin cancer, when we're performing IPL, what's your rule of thumb about regarding suspicious lesions? Do you treat around? Do you hold on treatment and refer for biopsy? Or is it just kind of dependent on what it's looking like?
I think it definitely depends on what it looks like and what your patient's history is, and I probably tend to be a little bit more conservative. Obviously, we never want to fire energy or IPL at a bunch of cells that maybe are, behaving a little bit suspiciously. So if anything looks a little bit funky, and it also kind of depends on where on their face that it is. Sometimes if it's quite large or if it's right smack in the area where I need to do IPL, then I'll wait until we kind of get a dermatology consult to kind of make sure that that's okay. I guess if it's small and off to the side, there's, in some scenarios, I might maybe treat the other part of the face if I genuinely don't see anything that looks suspicious. But my rule of thumb is that if it looks suspicious, it's just better to be conservative and just kind of delay treatment until we kind of make sure there's nothing kind of going on. And also looking in between each visits. Like I've had IPL patients that even just a couple weeks apart, something will just start to look a little bit funky. And I think it's okay to be like, no, we're going to pause. We're not going to, I know you've paid this, we'll honor the rest of your package, but let's just have, somebody else look at it. And I've had several patients where stuff has popped up and they are maybe skeptical to go see somebody because they just think it's like a little patch of dry skin. And they end up coming back and they're like, oh, I'm so glad that you made me go see a dermatologist for this.
Yeah, it's pretty much our rule of thumb at any point. If it looks funky, just refer it out, get it biopsied. It's better safe than sorry when it comes to any kind of facial cancer. I've unfortunately seen some, working with an oculoplastic specialist, patients coming in after Mohs surgery that I saw before, and I'm like, I never would have imagined the margins went that far or that deep. So, yeah.
That's so true. And I think because there is sometimes it's not always obvious on the surface. And so if you just treat around it, I mean, you could be hitting probably areas that maybe have cells that you don't necessarily want to hit. So I agree with you. Just be conservative. Just get that second look, get that biopsy before you move forward.
Yeah. So finally, I'd love to ask you, what 3 words or less would you use to describe optometry today in 2024?
Ooh, 3 words or less. These I'm not good at because I just like using a lot of words, but I guess Well, my backstory is that I think that this 2024 optometry is an exciting time because there's so much innovation, so much technology, like so many new things are coming out, like obviously an ocular surface disease, but myopia management, contact lenses, right? Like everything is just really booming. So I guess my phrase would just be beware of the curse of contentment. So that's way more than 3 words.
Okay. But I'll take it. I'll take it.
Because when I think about contentment, contentment is safe, it's happy, it's easy, it's comfortable. And while that is an okay place that's probably going to deliver adequate clinical care, sometimes when you're too comfy and too comfortable, you miss innovations because you're not kind of looking on the horizon. And so I think sometimes we can get stuck in that kind of curse to where then you're not being open to new things, you're not being super growth minded, and then you're not then offering the best to your patients. So
I like that. And I would say that in my life, anytime I felt uncomfortable, I knew I was going in the right direction because it was going to push my bounds. So I'm with you.
So true. I love it.
Wonderful. Well, Jessilin Quint, thank you so much for joining us here on the Mod Pod for this episode. It's been wonderful to have you. For those of our audience who want to know more and hear more from you, where can they find you on social media, and what is the name of your podcast?
I am on LinkedIn and Instagram. My Instagram handle is at Jessilin Quint, JESSILIN QUINT. And if any listeners love talking about dry eye or ocular surface disease, I would love for them to listen to a podcast that I co-host with Jackie Garlick called To the Point. We talk about all things dry eye, and it's really fun.
Wonderful. Well, thank you again for joining us, and thank you, Jessilin, for being here for the discussion.